Hello and welcome. My name is Adrienne Griffin. I'm the Executive Director of Maternal Mental Health Leadership Alliance, and welcome to this webinar. We have some great guests lined up today. Super excited to welcome all of you to today's webinar on demystifying digital maternal mental health platforms, specifically focused on those that help parents. And welcome. We're so glad that you're joining us here today. My name is Adrienne Griffin. I'm the Executive Director of Maternal Mental Health Leadership Alliance. And thank you for joining us for our webinar today. It is part 2 of a 2-part webinar series where we are introducing digital platforms that help parents experiencing postpartum depression and related mental health conditions. And again, welcome. So nice to have all of you joining us today. Welcome. My name is Adrienne Griffin. I'm the Executive Director of Maternal Mental Health Leadership Alliance, and we are welcoming you to our webinar today on demystifying digital maternal mental health with a specific focus on platforms that support parents. And special thanks to our sponsor, California Healthcare Foundation, for so generously underwriting the costs of this webinar. So we're going to start with a quick poll to learn a little bit more about all of you in our audience. Which profession do you most identify with? And just select one. And we always are just curious who is joining our webinars and how can we best help you in what you do to help new moms. Great. And for those of you who are just joining, welcome. My name is Adrienne Griffin. I'm the Executive Director of Maternal Mental Health Leadership Alliance. We're so glad that you're with us today for this webinar on demystifying digital maternal mental health with a specific focus on platforms that help new parents. So at the bottom of your screen, you can use the following, the Q&A button. Please, if you have a question for me or for our panelists, please put it in the Q&A, not the chat. We'll be monitoring the Q&A. Of course, you can always show captions to see the live captions and use the reactions button to share an emoji. We love seeing those emojis. So after this webinar, we will email you a survey to get your feedback. We'll share all of the presentation slides. You'll get a recording of the webinar, along with a fact sheet that includes information about each of the companies that you're going to hear from today, as well as contact information for the presenters. So we are recording this. You will get the recording. You'll get all the slides. So everything that you see here today, you will have after the fact. So Maternal Mental Health Leadership Alliance, we are a small but mighty team. There we are, all 10 of us. We are a nonpartisan nonprofit organization leading national efforts to improve maternal mental health in the United States. And our 3 strategic pillars include advocating for change, building partnerships, and curating information. For example, like this webinar. So we have, as I said, a grand total of 5 of us, 5 full-time, 5 part-time, including a graduate school intern, a small but mighty team, and we get stuff done. So let's start with some key facts about maternal mental health, just to make sure that we're all on talking from the same sheet of music, or singing from the same sheet of music, I should say. So we know these conditions include all of those listed on the right. They're mental health conditions that occur either during pregnancy or up to 1 year following pregnancy. And they are actually the most common complication of pregnancy and childbirth, impacting about 1 in 5 mothers in the general population and 1 in 3 in high-risk communities, including, but not limited to, women of color, parents with a baby in the NICU, military mothers, those with a previous mental health history. When we start listing all of those who are in high risk, we say, oh my goodness, it's almost everybody. That's why we want to screen and talk about maternal mental health conditions with all pregnant and postpartum parents. So the maternal mental health crisis in our country is severe. As I said, 1 in 5 pregnant or postpartum people, that's 800,000 families each year impacted by maternal mental health conditions. And sadly, the vast majority, as many as 75% of those impacted by maternal mental health conditions, do not receive care. This leads to staggering costs, significantly about $14 billion each year is the cost of untreated maternal mental health conditions in the United States. And we also know that untreated mental health conditions lead to long-term negative impact for the mother, the baby, the family. And tragically, we know that 23% of maternal deaths are attributed to a maternal mental health condition. Mental health conditions are the leading cause of maternal mortality. Fortunately, we know how to help parents get well. We know it starts with time off from work and includes self-care, some relaxation and mindfulness techniques. It can include social support, professional support from lactation consultants or doulas or counselors, and sometimes medication. But we know all women who experience maternal mental health conditions can recover with some combination of these components of wellness. All right, so what can we do about the situation? Well, we know it's dire. We know that moms need help. We know that there's not enough mental health providers to help all of the moms who need help. So that's why we're focusing on digital platforms, because they offer promising solutions to both improve care and expand access, especially to people in healthcare deserts. We hear more and more about rural hospitals closing, about not enough mental health providers in counties across the nation. And so digital platforms have the opportunity to address this specific need. So what are digital platforms or technologies? Well, just about 2 years ago, we at MMHLA started scratching our head and we're like, we don't understand what all these different platforms do. So we started attending conferences, we started talking to people in the field, and we've learned a lot over the last couple of years, which is what brings us to our conversation today. So we know that there are a whole wide range of different platforms or technologies, everything from enterprise systems and support. So these are things like electronic medical records, things that help clinicians provide services and support. That was our first part of our webinar. Today, we're focusing on patient-facing platforms, those that help new parents with wellness and support. And then there's others, therapeutic interventions, diagnostic and monitoring. But we are focusing squarely today on platforms that focus on helping new parents. So the question that we were wrestling with over the last several years is, okay, so which of these technologies are safe, reliable, and effective? We were reading websites, we were reading promotional materials, but we couldn't quite, sort it out who was doing what. And so we convened a technology council. We brought 10 companies together to help us understand this ecosystem a little bit more. So today we're going to meet 4 of those digital maternal mental health platforms or companies. These are all companies who have been vetted by Maternal Mental Health Leadership Alliance. They are members of our technology council. We've been working with all of them for almost 2 years. They pay an annual membership fee that funds professional development and networking opportunities like this. And they all share our commitment to promoting the mental health and well-being of our nation's mothers and childbearing people. So we're super excited today to introduce you to these 4 terrific women who are leading these companies. So these digital platforms, again, are focused specifically on helping parents. They increase access to treatment, support, and resources. They can help avoid delays and overcome barriers that are common in our healthcare system. And they provide access to culturally concordant care, because we know it's not just about getting access, but it's getting access to the right kind of care. So here are the 4 companies that we're going to be hearing from today: Candlelit Care, DOA, Mavita Health, and 7 Starling. Again, I'm so thrilled to be welcoming the leaders of these companies with us here today. Okay, so we're going to start with Candlelit Care. So Lauren Elliott is the founder and CEO of Candlelit Care. She is a mom of 2, and she, like many of us, experienced less than perfect birth with her first son, which, like so many of us, she is now using her lived experience to help others. Nobody grows up saying, hey, I'm going to launch a platform to focus on maternal mental health. Or I'm going to be an advocate in this field. It's just not a thing until something happens to you and you want to make the world a better place for others. So Candlelit Care is a virtual perinatal mental health service platform focused specifically for Black women. So Lauren, please walk us through how Candlelit Care helps new parents.
Yes, happy to do so. Thank you, Adrienne. And thank you so much for having us a part of such an important discussion today. And thank you all for joining. Oops, 1 second. Like Adrienne said, I'm Lauren Elliott. I'm the founder and CEO of Candlelit Care. And at Candlelit Care, we're truly on a mission to prevent delayed access to treatment, for perinatal mood and anxiety disorders, starting with pregnant and postpartum women who are at the highest risk of maternal mortality and morbidity, Black, new, and expectant mothers. Today, giving birth as a Black woman in the US means not only risking your life, but your emotional and mental well-being. As Adrienne mentioned, after I gave birth to my oldest son, who's now 8, I suffered in silence with untreated panic attacks before getting the care that I desperately needed. So I knew firsthand what that delay in access looked like, as well as the insurmountable amount of stigma that usually comes upon moms, especially new moms. Luckily, I eventually found treatment from a therapist who I'd say looked like me, understood me, and didn't make me feel worse. But for the 1 in 5 moms who experience perinatal mood and anxiety disorders, they don't often have that advantage, I'd say. And the question isn't often asked about how are they feeling really. It's usually a lot of focus on their baby, and their needs sort of take a back seat is what a lot of women feel like. I'd say that usually leaves about 75% of the new moms in this limbo period where they don't have delayed access, but where they have delayed access, but they are not feeling like they can speak about what they're experiencing, as all the stats that you just heard. I'd say it also, interestingly enough, leaves a large annual bill of over $14 billion for those who are entrusted with caring for us while we're in our hospital stays, both the insurance companies as well as our employers at times. So it does create this effect, this ripple effect that affects not only the mom, but her baby and her family, and it really becomes a societal problem. So I like to say, oops, sorry about that. So I like to say that's where we enter. So we solve not only a health crisis, but an economic one. Instead of the women and their families having to face these acute and chronic risks and conditions alone, what our model does, it creates a path that begins either before or after a provider referral. So we can work directly with parents themselves, or we can receive referrals from their doulas or their OBGYNs or pediatricians. Then the parents are matched with a candidate care coach. So we use coaching as an intervention. We also have our coaches enabled to screen moms. So we use clinical tools, but then we also weave in our coaching sessions as like qualitative understanding, just to kind of make sure that we are both making sure that we can create a nice through line if clinical therapy should be necessary. But the goal is to prevent. Yeah. I'd say we focus, that's my 3-year-old. We focus on the coaching is focused on setting goals for each of the parents. We like to also base their coaching on their perinatal stage. So whether they're pregnant or postpartum, and then together with their coach and their clinical team, they can complete all of those steps. And we also run training where we equip providers to support their clientele. Specifically, our training is focused on helping doulas and community health workers, and as of the past 2 years, identify perinatal mood and anxiety disorders. So we spend 2 hours training. We've trained over 200 doulas on how to identify all of the major conditions. So depression, anxiety, psychosis, OCD. That's been really wonderful because the doulas have then referred their clients to us. So it's been this wonderful partnership that we've experienced with them. I say that also when you are trying to serve populations that do have this mistrust, it's often tricky of how do you reach these moms. They're not always trusting of their providers. They're not always willing to open up and share how they're feeling. So we've had to really take an approach creatively to go directly to moms. Like I mentioned, we've trained over 200 doulas, and we've also been able to, one second. We've also been able to work with medical systems. So we've actually validated our model with Cedars-Sinai Medical Center and have interfaced and put candidate care in the hands of over 100 women over the past 2 years. So we're very proud to be able to say that. But it's been a lot of boots on the ground, pounding the pavement, and true advocacy mixed with technical support. So that's been a wonderful blend and marriage, I'd say. We've also, as of this year, speaking of being creative with distribution of candidate care, we've joined the Social Care Network, which is funded by CMS, Centers for Medicare and Medicaid. 1 second, buddy. Okay, you want to have a spot?
Oh, there he
Yes.
is. All right, so this is real
Yes.
life, right? We're
Yes.
working, we're
Mommy.
momming.
It's okay,
Yes,
baby.
yeah.
But I want to thank you all for your advocacy, for your presence today, for your patience, and just for understanding that solutions like all the ones that you're going to be hearing today truly want to meet moms where they are. And I just thank you for the time that I've had today.
Oh,
Thank you.
thank you so much, Lauren. And nice to meet your little guy. Yes, you're getting all kinds of hearts. I'm not sure if you can see him, but this is real life. Yep. I'm gonna gotta go get my dog in a second because he's outside barking like crazy. So glad that you're with us. And so grateful for you for we all know this. We want to talk to care providers who look and sound like us, who we can relate to, who understand what we're going through. And so thank you for filling that need for the Black women that you're serving. Yeah. Yay, we'll come back and circle back to you with some questions later. Okay, so next up we have Stella Faulkner. Stella is the founder and leader of DOA, which comes from the Korean word dowajo, meaning help. She also is a mom herself of a 3-year-old son, and her website includes this terrific line, which I really, really try to take to heart. Taking care of yourself as a mom is the greatest gift you can give to your child. So, Stella, welcome. Please tell us how and why you started DOA and how DOA can help new parents.
Absolutely. Thank you so much for the introduction, Adrienne. And thank you everyone for being here. So my name is Stella Faulkner. I'm the founder of DOA. DOA was born out of my own experience as a mother trying to navigate mental health support and nearly losing my life in the process. I'm now a certified peer specialist, postpartum doula, and lactation educator. But before all that, I was a mother sitting on the bathroom floor at 3 a.m. and trying to figure out if I was bad enough to need help and good enough to deserve help. And as Adrian mentioned, DOA comes from the Korean word toajo, which means help. And DOA was built to help bridge the space between mental health support and clinical care, that place where so many mothers live for months, sometimes years. So the reality is that not all mothers are ready to start therapy or can even access it. So DOA meets mothers where they are, offering clinically proven tools that fit into their real lives in 2 minutes between naps or after midnight. Our content library is created by licensed and certified maternal and pediatric providers, 95% of whom are mothers themselves. We also amplify peer voices because sometimes what helps most is hearing another mom say, "Me too," and encouragement that there is a way through. So our goal is to help mothers stabilize, feel seen, and when they're ready, connect to one-on-one care, and DOA serves as that entry point. So sometimes anxiety doesn't come from the baby, right? It comes from the system itself. And I remember calling the suicide hotline and no one picked up. So I texted. And in those messages, they almost immediately started talking about calling the police before even letting me really speak. And so I ended that conversation immediately. And it was, it sucked because I'd finally taken a step toward help. And that experience pushed me like 10 steps back. And so when moms tell me, and this is like a real quote, I probably have depression or anxiety, but I don't want to get diagnosed. I get that hesitation, that fear, it makes sense to me. And so it's no surprise that 75% of women impacted by maternal mental health conditions remain untreated, but trust comes before care. And so we built DOA to be that trusted safe space. Now, I share this slide not just as data, but as someone who lived it. I'm Korean American, and I only got help because a friend who happens to be another Asian American mom who I learned then had experienced her own mental health condition, noticed something was off in my text messages. And because of her background, I let her intervene and get me help. And sometimes I wonder if I would have gotten help otherwise. And even with awareness campaigns and the message that, you're not alone, the reality is that so many of us are alone in our minds, and getting help or believing that we can be helped doesn't seem realistic. So that thinking leads to a particular kind of loneliness, right? One that exists even within the care system. And I didn't always believe I could be helped for a variety of reasons. And that's the gap DOA was built to fill, combining lived experience with clinical expertise. And so every tool on DOA integrates validated interventions for regulation, mindfulness, and grounding, designed for culturally informed real-world motherhood, whether you're in the carpool line or nursing at 2 a.m. And so our release valve feature, which some people call a panic button, helps reduce 10 different intense emotions like anxiety, resentment, self-doubt, and others in just minutes. But the most powerful element is our peer voice notes. These are short, raw voice messages from real moms reflecting on their own motherhood and mental health journey. And they're designed to be like a voice memo you're receiving from a friend. So I want to play you one, and it's called Why Can't We Ask for Help? And it's about a minute long.
Hey, I just wanted to check in and see how you were doing. I had a conversation with a friend recently, and we were just talking about how challenging it could be to ask for help when you really need it. And that sometimes it's hard to also step away and get yourself the help you need when you feel like you can't leave your child. But the best advice that I could give is that if you picture your future and your child's future, and if they were going through what you were going through right now, try to be the example for them in what you would want them to do in that moment, so that when they have to make that tough choice, they know that it's okay to ask for help themselves. I hope this helps you get to making the decision to get the help that you need, no matter how tough it might be. We'll talk later.
So sorry, when I listen to these, I still get a little emotional. The moms who recorded these could not do it for longer because they got emotional themselves, because it was a voicemail that they were saying to their former selves now that they're on the other side. Anyways, let me get through this. um, so I actually had someone reach out to me to help connect them to one-on-one care after listening to that message specifically. So sometimes what mothers need most isn't therapy at the get-go, it's permission, right? Permission to feel, to rest, to not be okay. And that's what our peer voice notes offer. And they're our most listened to feature. And the research on the efficacy of peer support supports this, right? Peer support reduces postpartum depression risk by about 30%. For high-risk mothers, it can reduce that risk by up to 50%. And peer support also improves engagement with therapy, confidence as a mother, and reduces isolation. So in short, peer support can help mothers get to you, the clinicians, stay with you, and maintain recovery. So when I was in the depth of my depression, my mental health affected everything. My body was in constant pain. My parenting guilt and anxiety were through the roof, and my relationships and sense of self was hanging by a thread. And that's why DOA offers integrated support for the mind, body, parenting, relationships, and identity, available 24/7 nationwide. And because we're non-clinical, we're not bound by state lines, which means we can reach families fast, equitably, and affordably. Parents can access unlimited coaching, support groups, and workshops led by mental health therapists, occupational and physical therapists, pelvic floor specialists, pediatric experts, sleep coaches, and more. DOA is all evidence-based, all peer-informed, always growing and expanding our resources. We literally take requests from parents, and we're always accessible, even at 3 a.m. For clinicians, DOA isn't a replacement for therapy, it's a bridge. So we provide 24/7 peer-informed support that helps mothers stay connected between sessions, reducing crisis escalation and improving continuity of care. It helps moms practice skills, reflect, and stay engaged with the work you're doing, even when they're outside the therapy room. And we partnered with diverse providers across multiple specialties nationwide, so you can extend your reach knowing your patients are supported in between appointments. So our goal is simple: help mothers stay connected to care and help you reach them before they reach a breaking point. So in closing, I almost didn't make it, right? It sounds awfully dramatic, but it's the truth. And there are moms who are still trying to make it, many of whom are navigating this journey alone. And I needed a stepping stone, but I didn't have one. I couldn't find one, but I got lucky, and I know that. So that's why I built DOA. We meet moms where they are, walk with them until they're ready for more, and provide a bridge to help prevent them from falling through the cracks between mental health support and clinical care. But thank you for your time. I appreciate you all being here and the work that you do. When it comes to making lasting change in maternal mental health, it will require all of us to work together. So I look forward to partnering with you.
Oh,
Thanks.
Thank you so much, Stella. I'm all choked up. I am so grateful to you for sharing your story. And well, it really takes me back to when I was in that same situation and not sure if I was going to make it and not sure that I was worth it either. So thank you for putting your words to that and then for taking what you went through and making it so that other women don't have to suffer. I am so sorry that when you reached out to a suicide crisis line, that it wasn't answered. Like, that is unforgivable. And it's partly why we lobbied and got money to create the National Maternal Mental Health Hotline. So it's a 24/7 voice and text hotline that moms or others impacted by mental health conditions during and following pregnancy can access, because it is unacceptable that somebody calls a hotline and it's not answered. So I'm just all choked up. So I am so grateful to you for the work that you're doing. And I just want to point out that each one of these different platforms and each one of these different women, amazing women, are filling one of those needs on that components of wellness chart. So Stella talked about peer support and how absolutely vital that is. We hear over and over from women that it's the peer support that is what helps them shift. Because all of us who've gone through this all think we're the only one who've ever felt this bad, that we're the worst mother in the world, that our families could be better off without us. And so when you hear somebody else put words to that, you're like, well, wait a second, I'm not the only one. I ran peer support groups for 10 years, and I think that they are just an incredibly valuable part. So thank you, Stella, for offering these services. So thrilled that you've started DOA. And do you have any statistics or anything you want to share with us? How many moms you've helped? Do you have anything like that that would help people see the extent that you've had an impact already?
No, I don't have any concrete numbers to share at this time.
Okay.
Yeah.
Awesome. But keep up the good work. Thank you for being with us today. Okay, so our next company is Mavita. And with us here today to talk about Mavita is Dr. Sarah Orrick. She is a reproductive psychiatrist, which means that she is a very highly trained psychiatrist who focuses on women's mental health, specifically during the reproductive years. So things like, challenges that teenage girls go through with adolescence, and then the childbearing years, and then menopause. She is also a mom of 3. She also speaks Spanish fluently, which I think is part of what led to naming the company Mavita. So Dr. Sarah, can you tell us first what Mavita means and what Mavita does?
Absolutely. I'll start there. Mavita means mama and vida together. So really maternal life. I'm so impressed by how many people are here, how many people want to contribute to this field. It is so exciting to see that we can actually make change. I actually came to this field really out of what I saw in medical school. I was just kind of shocked how little research there was on women's bodies, on women's mental health, and ultimately was very lucky to train at Columbia University for my general psychiatry residency. And then they had a fellowship specialized in women's mental health and reproductive psychiatry. There's only 15 in the country. They graduate about 1 to 2 medical doctors. But went from there, private practice, work with big health systems, including Providence Health and their collaborative care program, but ultimately realized that this knowledge was sort of in small elite academic centers, and it really needed to be scaled. More people deserve to be able to know how to treat people in this situation, and more people deserved accessible care. So I tried to do some education on social media, grew that platform, but ultimately the most common message was, how can I actually get care? This education is wonderful, but it's not enough. So that's really the origin story of Mavita. And as I was starting to build Mavita, I actually had a second trimester loss. And as an expert in the field who had been in therapy, but I wanted specialized care, it was hard for me to get care. And I thought, if I can't get care, who the heck can get accessible care here? So I've been really excited to build Mavita, really in support of every woman, and really trying to, again, get this specialized care out to more people. We have 3 sort of pillars of our care. Our really crowning jewel and our most important is the clinical care that we do. That includes individual therapy, group therapy, couples therapy, as well as highly specialized prescribing, even for the really vulnerable times, including pregnancy and lactation. And we're currently live in California, New York, New Jersey, and Texas. And our app, which is free, so you can download it now across the country, has evidence-based content created all by our in-house staff, as well as community, because we understand the importance of connecting with others and how isolating this experience can be. But once you start to learn, oh, there's someone in my area that's also experiencing this, we understand that a lot of this needs to also happen in real life and the importance of that. But of course, the virtual care is this really great private place to start your care. And I think it often meets moms where they're at. Here I am. So I'm one of the only, this is really a unique sort of differentiator for us, is that this is one of the only clinically founded and led organizations of our kind. We are delivering evidence-based care, mostly focused on CBT and ACT models, as well as that highly specialized prescribing. We serve patients from mild to very high acuity and cross-diagnostic. We understand that people still have ADHD diagnoses, bipolar disorder, that they have postpartum psychosis. And again, we have a comprehensive prescribing with flexible care. And because I realized that some of these programs weren't accessible to most providers who frankly are frontline, like psychiatric nurse practitioners and master's level clinicians, we created a proprietary training so we could specialize these very talented clinicians who frankly wanted to do this type of care, but just weren't finding the education to do it. And this has allowed us to attract and retain the highest caliber of clinical talent. So we really have consistency and fidelity between care, which I think often is missing in virtual care platforms, where they're able to give access, but you're not sure if you're going to get a good therapist or one that maybe isn't as proficient. And so that quality of care is really important to us. This is just a little bit of our flexibility. We flex from those things that you don't have to be in clinical care for, like the education and the community, but then we flex all the way up. So we've carried really high acuity patients that tend to be in one or two, more than 2 lines of treatment, frankly, and really been able to hold them, which is really exciting. And also, we are really prescribing in these very vulnerable times with all of the nuance that comes with prescribing during pregnancy, for example, which is a really hard decision, especially when you're getting so many mixed messages from our administration, for example, or even in the postpartum and lactation, and as well as doing cutting edge treatments like providing the first FDA-approved treatment for depression, for postpartum depression, called zuranolone. So we do controlled substances when they're needed. We also help with disability care because we understand that that's such a huge part of people actually getting the treatment that they need. And of course, because we still need paid federal leave. So we're an affordable, accessible, and scalable model. On the left, you'll see all of our insurance panels. And we're really excited about what we've been able to grow in the 4 states where we're active and growing. And of course, 90% of our population is paying $35 or less, which when you think about, and I think about my private practice or those of us that are highly specialized, that's like nearly impossible to find. And then when you can potentially access it, the wait can be 3 months, 4 months, right? Times that people just can't wait. So what we're really proud of is we can get people in as quickly as 2 business days, because when people are motivated for care, you really have to capitalize on it. Getting into mental health care, like Stella mentioned, is something that is people have so much ambivalence around. So we really want to meet patients when they're ready. And here's just a little bit of data collection is the foundation of everything we do. It's one of our first hires was actually a PhD level researcher, because I also understood the clinical care isn't there that's scalable, but we don't have the women's research that underpins all of this in a really robust way. So that's helped build an evidence-based clinical model that's really supported by a novel measurement system. We don't just do PHQ-9 and GAT-7, though here you will see that those are depression and anxiety screenings that we do. We also collect functional system reduction. So if people are actually functioning or not, which is one of the best measures of how our treatment works, as well as specific mechanisms of our change for our care model. So really seeing if the care model that we're using, which is based on ACT, is truly helping people become more psychologically flexible, for example, which is one of the goals. Allowing us to really understand how our care is going in a really micro level, but ultimately we want to apply that to a macro level. And we're really excited about ultimately our goal is to give patients personalized medicine, which has never existed in this space. So I can come in and you'll know exactly what medication treatment may suit me, what psychotherapies may suit me. And that's really our long-term overarching goal. And so here are just a couple of I'll give 2 case examples. And here's one with a sort of more a most common patient, 7 weeks postpartum depression and anxiety. And here biweekly psychotherapy and med management, and you'll see the PHQ-9, which is that depression screening, GAT-7, the anxiety, as well as the functional impairment going down. What's really exciting here is that we all talk about measurement-based care. Those in clinical care have heard about this, but often if you've been a patient, you fill out a form, it gets thrown in a chart. No one ever tells you what you scored or what your risks were. And our survey response are consistently double industry norms, around 80%, because we teach our providers and have built a platform where they learn to interpret the data, and then they're feeding it back to our members. So our members actually understand why we're doing this and firsthand kind of understand what's happening in their journey. This we also feed back to our referring clinicians, which we really love that, because often therapy is this black box that no one really understands, but that's been exciting for our pediatric and our OBGYN referring partners. And then the next is going to be one of our higher acuity patients that we've seen. Of course, postpartum psychosis is our one sort of psychiatric emergency in this field. We see the patients after they've been stabilized in an inpatient unit, but can really hold them, seeing up to 3 to 5 times a week. And this is just an example of a patient who we were able to kind of get through this, I would say, the most difficult experience they've ever had. Out the other end, where they're able to care for their baby, where they're able to function. And that's just been really exciting to see. And again, that ability to flex up and down is a huge importance to us. It's a little messy here, but if you help me, if you can follow along, what we're doing is we're pairing subjective data, which is really interesting. And now we're grabbing objective data. So if you feel comfortable sharing your Oura Ring or your Apple Watch, we are finally kind of melding the steps, the hours of sleep, and turning that again into evidence-based treatment that gives sort of a richer, multidimensional picture about what patients are actually doing. And I'm so excited to bring these new tools into clinical practice and actually make use of them. I know it's really fun for people who do this to like gamify their sleep patterns, but here we have your clinician actually making sense with them of, oh, you started a medication and then all of a sudden your sleep patterns improved or they got worse. Really trying to bring the subjective and objective together. And objective data always has been something that psychiatry has lacked. And so really building that, I think, is incredibly important to us. This is just a little bit about the referral process. We know it can be incredibly burdensome. I've worked in collaborative care models where we often try to push some of the load to other clinicians, and they're like, no, 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 you're the mental health prescriber, you're the mental health expert. And so we really want to do that. We'll do a warm handoff. We have a form electronically that helps kind of ease that process. But again, we want to meet both clinicians where they're at and patients where they're at. And the ongoing updates, I think, has been really exciting. When I think the standard of care has been, you have no idea what happens when you refer a patient out. Our leadership team is incredibly phenomenal. We're so excited to have this team and grow it. And if you want to get to know us a little bit more, please download the app. It's available nationwide, free of charge. And we're also have a growing social media presence where I provide some education. At Sarah Orrick MD is Instagram, and Mavita's is at Mavita Health. Follow us and check us out.
Thank you so much, Dr. Sarah. Really amazing. So we can see now, so we had our first 2 platforms that were providing non-clinical support, and both Mavita and Seven Starling are providing clinical support. So that means counseling, therapy, and medication management. And because you provide clinical support, you have to be licensed in state by state, right? Because you have to have clinicians in that state, right?
Yes, absolutely.
Yes.
Currently, California, New York, New Jersey, and Texas.
Yeah, and I saw that, which is great because those are 3 of the California, New York, and Texas are 3 of the top 5 states in terms of size. So that's awesome. So
great. Yes.
Yeah, I think Florida and Michigan, maybe, I can't remember, but the others. So that's great. So all of this is leading to one of the questions in the Q&A, which is from Christine. How, as a state maternal child care RN, can I promote your apps in a statewide way? So in particular, So, so Lauren and Stella, because your apps are not clinical, anybody can use them anywhere. But for Mavita, because it's, can you talk to a little bit to that, Dr. Sarah, about how can she
Yes.
promote your app?
So you can use our app with content, which is all evidence-based. So it's used to prop up what we do in clinical care, but it also stands alone, as well as the community chats. Those are both accessible nationwide. And our chats are also moderated, which is really exciting and a difference from, I love people getting together on Facebook, for example, but then you have some misinformation. We have sort of guardrails against that. So that's a really exciting sort of safe community. And then the clinical care is just something that would happen in the states where we operate.
Yeah, yep. So thank you. So I was looking at the chat as well, and somebody put in there, she wishes these were available in India. So, all right, so take it internationally. That's next, right? But Lauren and Stella, could somebody in India use your platforms?
Yeah, I've actually served moms in Trinidad and Tobago, which is in the Caribbean islands. But yes, she's received coaching there.
Awesome. How about Stella?
Technically, yes, but we haven't opened up the app yet internationally.
Okay, good to know. Awesome. Thank you. Okay, so last but certainly not least is Tina Kashani from Seven Starling. So I have known Tina now for, gosh, almost 5 years, just when you were launching Seven Starling. And we just found out today that Tina, well, we knew she's a mother of one, but she is soon going to be the mom of two. And so somehow all of you amazing women can keep all these balls up in the air, being a mom, running a business, doing all of this work. So impressed. And we're so, so happy to welcome you back, Tina. So tell us about Seven Starling.
Awesome. Thank you so much, Adrienne, and the MMHLA team for organizing this and for everyone who took time out of their day to show up. And I'm just so honored to be in this space with other incredible female founders, advocates, and supporters. It's such a huge issue and problem, and I think just takes so many to solve. So just so impressed by what everyone is doing and all the different ways we're approaching it. I've already learned so much myself. As Adrienne said, I'm Tina Kashani. I'm the co-founder and CEO of Seven Starling. And we are a women's mental health platform, and specifically today focused on maternal mental health. And this focus really came out of both, as Adrienne mentioned, my personal, but also my professional experience. My background is in the healthcare innovation space. Prior to founding Seven Starling, I was at Warby Parker for over 6 years. I helped launch their optometric telemedicine practice and scale that in the very early days of telemedicine back in 2015, before COVID even happened, and just saw the opportunity around scaling a solution like this, and just saw that there was really nothing available when it came to women's mental health, and just saw such an opportunity to build something that created change and was scalable, and really focusing on how businesses can not only become important businesses and scalable businesses, but also ones that do a lot of good in the world. And so really thinking about how you combine those two missions together. So Seven Starling really took flight to ensure that every woman had the specialized and affordable mental health care that she deserves. And that's really at the core of everything that we do. In terms of what we offer, we really have 4 key components that we provide Seven Starling. And it's really at the very center, providing a specialized treatment model that supports the entire motherhood journey. So we provide specialized therapy. All of our perinatal all of our therapists are perinatal experts and have expertise in this space. We really think about the model in 2 ways, not just the very important one-on-one support, but also group support. So when someone signs up for Seven Starling, they get matched with a one-on-one therapist and a small group of 5 to 10 other women in the same stage. If they have more severe symptoms or have a need for medication, we can also match them with our amazing specialized psychiatric nurse practitioners and psychiatrists to really get that holistic support across one-on-one, group, and medication. And then our app offers really rich exercises and content all around what our patients are going through in the journeys, and just underscoring a lot of the themes and exercises they might go through with their therapist or in their group. So it's really this holistic experience. And it really reinforces itself across the individual therapy and that relationship with your one-on-one therapist, between the conversations and support you get from your group, between the app curriculum, and if you're on medication. All of that is self-reinforcing and really brings together themes and actually specific IP and programming that we've created within Seven Starling around what that journey might look like for you as a mom going through this experience, and some of the themes and frameworks that might be helpful as you work through these various challenges. And really, our providers are at the core of what we do. It's wild, but we now have over 200 clinicians on our team across 18 states and growing. So we have an amazing team of licensed clinical social workers, psychiatrists, psychiatric nurse practitioners, family marriage counselors, and really that are focused on supporting moms during this time. We really look for not only training and expertise, but also a deep passion for serving this patient population, at least 1 year of work experience supporting moms, and really think about the matching experience where what that patient needs, and also that specific provider background. And I'm really proud that over 50% of our providers do identify as BIPOC. And that actually is very reflective of our very diverse patient population as well. And we think a lot about that in our matching process. So you can see here, we are operating at scale. We are available in 18 states, that's the dark purple today, supporting moms. And you'll see in the next slide, we have very broad in-network coverage across each of these markets, and Medicaid in many as well. So that is part of what makes Seven Starling really special. It's the scale and access that we really focus on, meeting mom where they're at, providing quick, affordable, specialized care. And we're planning to expand to 30 states by the end of next year. So we are moving quickly, trying to make sure that moms everywhere have access to our platform. And this is just a small snapshot of the plans that we accept. We cover over 100 million lives through our contracts. We work with every major health plan out there. We have many national, regional contracts. Today, actually, as of this month, we have 96% of patients using their insurance to get care. And we accept Medicaid in a really broad capacity across 5 markets today. That's Virginia, DC, Maryland, Texas, and North Carolina. And then we're actually expanding to another 8 Medicaid markets next year. So just doubling down on making sure that our Medicaid moms have that really important support as well. And one of the key pillars of Seven Starling is being a trusted partner within the healthcare ecosystem. So we know a lot of our moms are getting sort of initial support from their OBGYN, or having that initial conversation with their OBGYN. And so we really have partnered with OBGYNs across the country. We work with over 1,500 actively referring OBGYNs today, who, when a mom screens positive on their mental health screening tool, they can send them over seamlessly to Seven Starling. We integrate with their EMR, make it super easy, and then offer them updates on how that patient is doing and continuing with care. And actually over 90% of our patients today learn about Seven Starling through their OBGYN. But anyone can sign up on the Seven Starling website and schedule a consult with our team. So this actually, really what this really means is we work with over 450 referring clinics across the country, over 40 hospitals, and we received over 10,000 referrals to date, just to give you a sense of the scale that we're operating at. And these are just some of the incredible and trusted organizations that we work with and partner with. You'll see a lot of names you're familiar with who are really leading the way when it comes to healthcare, and really see us as a trusted partner. And one of the things that I'm personally really excited about that we've been focused on this year is deepening our tech-enabled tools and integrations with our healthcare ecosystem partners. So offering integrated and auto screening tools that automatically can navigate patients to a resource, including 7-Starling, preventative education programs. We just launched an amazing program called Mindful Beginnings that any mom can actually sign up for on our website and get content on how her mental wellness and well-being might shift and change throughout pregnancy and postpartum. And then automated outcomes reporting on how their patients and broader patient panel are doing as it relates to their mental health. And these are just some of the results that I'm excited to share in terms of how we're leading the way. So as you'll know, it often takes patients over a month, weeks to get into that first appointment. They can get into a first appointment on average in 7-Starling within 7 days. They actually get matched within 24 hours, as you can see here on the left. But, you know, with scheduling and finding a time that works for you as a patient, it often takes on average about 7 days for them to actually attend that appointment. So it's really based on the patient's preference. And then within 2 to 4 months, we see statistically significant outcomes with 90% seeing an improvement. And we all know that the longer you wait, the worse the symptoms get, and they can worsen pretty rapidly. So that time to care is one of the most important things that we look at. And then I'm excited to share that we actually just published our first patient outcome study. I just shared the link in the chat. Here are just some of the amazing results that we've seen across our patients. And this is thousands of patients that we've treated to date. You can see that every component of our model between the individual, the group, and the medication drives better and better outcomes, all of that combined. What we've seen is that over 90% of our patients see a statistical improvement in their symptoms. 97% feel the time they spent with their therapist was really valuable. And we have an average, which I still can't wrap my head around, but an average satisfaction score of 4.9 out of 5. So patients are getting better. They love their therapy experience, and they're really enjoying the time that they spend on the platform. And really, at the end of the day, what really brings us to this mission is not just thinking about the diagnosis, but the overall impact that we're having on patients and what this means. And you've already heard so many of the really powerful stories from the group here around how important and challenging and joyful this time in life can be. But really thinking of ourselves as a major support system as part of this big transition. So many of our patients come to us with lifelong history of depression, anxiety, or a lifelong struggle with just this journey overall. Many of our patients experience suicidal ideation, more social isolation as they might be moving to a new place and just feeling more isolated than normal. More history and experience with either PTSD or traumatic birth, having a baby in the NICU. And of course, we see a rise in domestic abuse. And so all of these things are just so important as we think about the patients that we support, understanding that, again, it's more than a diagnosis, but it's really how can we provide that really critical support during this time. And that's it for me. I've so appreciate being part of the panel, and I've included just my information here in case anyone wants to reach out.
Oh my gosh, Tina, I can't stop smiling. I feel like you're all grown up now from where you started to where you are now. You're in how many states? 18 states, 20, whatever.
18 states, and we are
Wow.
launching in Ohio. I saw some Ohio folks here. So Ohio is coming this quarter.
That is just amazing. And I know how hard it is to handle all of that insurance paperwork. And so hats off to you. Great job. So happy for you and for 7-Starling. And well, I was going to ask, how do patients learn about you? But 95% is through the obstetric providers.
90%.
90%, yeah.
Almost, yeah, exactly. But anyone can sign up on the website. You can
Gotcha.
consult with our team.
So that was going to be my first question to our other three presenters. How do your clients or your patients find out about you? So we'll go kind of in reverse order. So Mavita, how do people find out about you?
Yeah, we have an interesting take on this, but as I grew the education platform sort of on social media and that following, we realized how important it was to meet moms where they're at. And moms are in the podcast, they're on social media, they're getting a huge amount of their, whether I like this or not, of their medical information online. And a lot of it is mis and disinformation, of course. And so we meet moms there. We work with a lot of wonderful partners who are also in sort of that baby space. Again, to do in real life events, to kind of make sure they know, even though we're virtual, we're real live sort of moms and have lived experience, et cetera. We also work with our payers, so our insurance partners and our referring providers are a hugely important part of it. But we think about that, like, you hear me on a podcast, it happens to be covered by your insurance, and then your OB mentions us. And that seems to be something that works really well for us.
Yeah, thanks, Sarah. And you said something that it just rings so true to me. It's like you're real life people. You're delivering all of the things in that components of wellness chart. We're just doing it through your phone or your computer instead of in person, right? And so when I had that realization about what many of your platforms do, is like, aha, that was the aha moment for me. It's filling in the components of wellness. So Stella, how do people find out about DOA?
Similar to Dr. Sarah Orrick, we're in a lot of parent groups. We do events, we do word of mouth. I also do like the podcast, things like that. Just as she mentioned, it's really meeting the parents where they are. We do a lot of hyper local stuff around Brooklyn. And I don't know, we have providers across the country, so we work with them as well. Yeah.
Great. And Lauren, how about you? How do folks find out about Candlelit Care?
We have like a multi-channel outreach strategy as well, where we're on social media. We're on we just launched the podcast actually this year, but a lot of our training sessions where we train doulas, a lot of doulas will refer, which is nice because doulas don't often feel like they have anywhere to send their clients. And they just sort of a full service sort of and on the non-clinical sphere. So that's been really helpful. And we do a lot of events. We serve on panels just to sort of spread awareness in that way too. So yeah, that's been helpful.
Gotcha. Okay, so I've been monitoring, looking at the Q&A, looking at the chat. So somebody asked about part 1 of this webinar series. So that's available on our website. I'm going to ask Mara if she wouldn't mind dropping a link into the chat that is a link to that. So as a reminder, so part 1 of this webinar series included other companies from our technology council who focus on supporting providers. So they help providers do things like screen or assess maternal mental health conditions, provide collaborative care integration. So it's very focused on the providers. And then of course, our panelists today focused on parents. But many of these companies or these platforms do a little bit of both, but they have a primary focus either on supporting the provider or supporting the parents. Thank you, Mara, for dropping that in the chat. Let's see, let me look at the Q&A real quick. Let me see if there's anything that's still open in there. Does Candlelit Care offer services nationwide?
Yes, we do. We lead with our coaching. So yeah, that's available across the country.
Okay, great.
And in Trinidad, apparently.
Yeah, and in Trinidad. And hopefully now, pretty soon, India.
Our focus across the country.
So I'm curious if any of our panelists have a question for the other panelists. We just have about 2 minutes left. I guess we all did such a great job. Thank you. So we are launching just a second poll as we wrap up here. If you wouldn't mind taking just a minute to say, did you find this webinar helpful? Yes, somewhat, or no? And as a reminder, we will be following up with all of you with an email that includes all the information from the webinar. So it will be the recording, it will be the presentations, it will be contact information for our speakers, as well as the information from the first webinar if you want to access that as well. We're seeing lots of thank yous in the chat. Thank you to our terrific panelists. Big round of applause. Great job, everybody. I don't know if you can see the chat, but everybody's like, brilliant. Thanks. Such great information. Thanks for joining. We're so glad that you are here with us today. Please sign up for our newsletter so you can stay in touch and hear about upcoming educational opportunities. And you'll be receiving, again, all of this information from our different companies, how to get in touch with them, and if you need to follow up. Again, thank you all for being with us today. Enjoy the rest of this day, and we'll see you soon.